All right. So, welcome back to another audio lecture. In this lecture, we're going to be talking about thrombi and emboli. And so, you might be more familiar with these as thrombus and embolisms. Um, and so, these are going to be primarily due to blood clot formation and circulation. Right. And the reason we lump the two together is because thrombi have potential to develop into potential emboli, right? And thrombi is a blood clot in circulation, and then when a piece of that blood clot breaks off and travels to a distant site, blocking a smaller blood vessel is considered an embolism. And so a thrombi could potentially become a much worse problem affecting other tissues in the body. And so we see that this thrombi can increase under certain conditions, right? And so we actually have three different factors, and these are called Virchow's triad. And Virchow's triad talks about three factors that increase the risk of thrombus formation, including endothelial injury, right? So anytime we damage the endothelium, we roughen up that surface, and then when we roughen up that surface, platelets like to adhere to that surface, and red blood cells start to experience turbulent flow. Well, as this endothelial cell starts to become injured here, okay, we could even it could be due to puncture, right? But we create a rough surface for the potential for clots to form and start developing. We could also have the circulatory stasis, like we saw in dilated cardiomyopathy, where we have the stagnant blood in the left ventricle because we can't squeeze it all out, right? So we saw that dilated cardiomyopathy was a systolic disorder, and it affected the contraction of the ventricles because now we have weakening of the heart. And so we could potentially get a thrombus forming in the left ventricle, and that would there's worse places to get it, I would imagine, but it's not going to be good because that is the passage to all of our tissues. Okay? And then the last state is going to be hypercoagulability. And so we see if you have an increased risk for blood clotting, this could potentially form spontaneous blood clots if the blood slows enough. And so we get the three trifecta here. You could end up being at risk for high risk for thrombi formation, depending on your individual situation. And why are thrombi so bad? Well, these can occlude blood vessels and promote increase resistance to blood flow. If you increase resistance to blood flow in a blood vessel, well, blood flow decreases. Okay? And so the thrombi are not supposed to be in our arteries, unless they are clotting a leakage from our circulatory system. And so again, we could see the formation of embolisms from thrombi forming in circulation. So for this, I suggest everybody know what a thrombus is, what an embolism is. Take a look at Virchow's triad. Um, so, like I said, embolisms can block smaller vessels, so they are going to be fragments of a thrombi that is formed in circulation. But we have other things that could also be embolisms as well. These could be air, fat, tissue, bacteria, amniotic fluid, tumor cells. And so we see a number of things that can actually act as embolisms. And so amniotic fluid is going to have proteins. It's not going to be generally uh, it's going to have foreign contaminants in it. Tumor cells, obviously, if it's a fairly big chunk of tumor cells, or if you get a tumor cell finding a new location and it sets up growth, and then that growth ends up blocking blood flow. Okay. Air, so this is one thing that you want to make sure whenever you insert a needle in somebody, that you want to make sure you're not injecting air into them. These air molecules don't really move through our circulatory system too well, and they can get kind of stuck, and they block all blood flow after that. Um, Bacteria, infective endocarditis is a nice example of this, in that we have bacteria that can be spread throughout the body, and these plaques can form from these bacterial growths. Okay. So again, I want to emphasize that thrombi can be become embolisms, and this is a nice example of this. Um, these oftentimes form in venous circulation. And why do they just preferentially form in venous circulation? Well, the blood is moving slower in venous circulation. It's not as high pressure. Um, and so we can see um, that the deep vein thrombosis, which I'm sure you guys have heard of, because this is a common commercial on, if you've ever been to your grandparents during the day and you've been watching it, you've probably seen a commercial advertised for deep vein thrombosis. These are common in older individuals, and so this can happen. And the problem is not really due to the thrombosis in the deep vein, although it is going to be impacting blood flow in the deep vein. But remember, this is a collection vessel. The issue here is going to be an embolism forming, and specifically an embolism traveling to the pulmonary circuit, impeding gas exchange in the lungs. Okay. So here we have the blood clot. So it occurred in the legs, okay, and then it travels back up into the lungs because this is the next big circuit after that. So we go up to the heart. There isn't really much that's going to impede this because all the vessels, all the veins after this site here are getting larger and larger and larger, right? So we don't have a smaller vein there until we get to the lungs. And so once we get to the lungs, this is a slightly incorrect image here, because this shows the blood clot entering the bronchial system, and it is not in the bronchial system, but rather it is in the circulatory system. And if it's in the circulatory system, it's going to be blocking this area from actually undergoing any kind of change. So now you have an area of your lung that is non-functional, and so now you are decreasing oxygen to a lesser extent. So if it originates in the arterial circulation, this could cause some really big problems, right? It specifically a brain and heart infarction, or brain or heart infarction. So the lungs, I think we can generally be okay for a little bit if we have an infarction, but really the brain and heart, we don't like blood flow to be interrupted at all. They start to undergo cell death relatively quick. What are the manifestations? So depending on where it occurs, if it occurs in the venous system, we're going to have some manifestations that are specific to that site. And so we would still have a pulse present because we're still receiving some blood flow to the site, but compare these two legs here, and this leg looks swollen, and so we have edema present. It looks red compared to this leg, and so it's going to be red. It's going to have a pulse present, edema, but it's going to be kind of cool, right? So we don't have the normal circulation that we're seeing. All right. So if it develops, if the thrombus forms on the arterial side, we're going to see a weak and absent pulse because now we're blocking blood flow. We're seeing a cyanotic appearance, meaning it's blue in appearance or purple, because now the blood's getting stuck there, and now all the oxygen is being removed, so it's starting to undergo that color change. It's going to be warm to touch, and the edema is generally going to be absent compared to what we saw with the venous circulation. Okay. You're going to use several imaging techniques to be able to visualize this and be able to target and verify that there is a blockage. And so angiography is going to be one technique. For angiography, we're going to inject a contrast dye, and then we're going to visualize blood flow through the body. And so you should have some sort of idea about where it is occurring in general, so you're not just hunting for this decreased blood flow. You'll use an ultrasound to kind of listen. Echocardiograms and MRIs would allow you to look at the vasculature. So in this picture over here, we have a blood clot that is formed right here. It's preventing blood flow from really moving downstream. It's not completely occluding it, but it is blocking a substantial amount of it. After, you can see here we have treated the blood clot, we've busted it, and now we get adequate normal blood flow returns. Okay. So how do you prevent blood clot formation? Drink plenty of water, anti-embolism hosiery, pharmacological treatment, and this pharmacological treatment would include the same treatments so thrombolytics, anticoagulative, pharmacological tools as well. Anything that's going to prevent the formation of a blood clot. So if you have active thrombi, thrombolytic agents, and embolectomy, so removal of the embolism that has actually occurred. All right. Well, that is the end of this audio lecture. All right. Until next time.